We acted immediately.
Premier Doug Ford on April 7th, announcing the current stay-at-home order, defending his government, deflecting blame.
The capacity at the ICUs and these variants have taken off even beyond what they told us.
Critics say that wasn't true.
To suggest that any of this was unpredictable and occurred faster than was anticipated is a fiction.
Consider this moment 2 months earlier.
Am I missing something here, or is this presentation actually predicting a disaster?
No, I don't think you're missing anything.
Ominous modeling showing if public health measures were lifted, cases would likely surge along with ICU admissions. A key finding was sticking with the stay-at-home order in place then will help avoid a third wave and third lockdown.
As health workers working on the front lines, remember that day and that conversation very well. We probably could have avoided this catastrophe.
Despite the troubling projections, the province gradually began easing restrictions.
People are tired. I'm telling you, they're tired, they're exhausted out there.
But all the while, doctors were sounding the alarm, fear and anxiety building.
Today on my shift, I've seen more cases than I've seen in the last month.
We need bold action, decisive action today to protect us.
Province-wide action would not come until April 1st, and it wouldn't go far enough.
So the modeling
that day, more alarming modeling, loud calls for a stay-at-home order ignored.
Under all the scenarios, cases do grow for a little while. However, with both the 2-week and the 4-week stay-at-home order, they do start to break and come down.
Ontario defied that advice, moving instead to a so-called emergency brake shutdown, non-essential retail allowed to stay open. The condemnation was swift. This doctor writing, "It's allowed but should be avoided," is the meaningless cop-out of a gutless leader. Another posting, "To allow this third wave to get so out of control is both a catastrophic and unimaginable moral failure." It would take the province almost another week, waiting until after the Easter weekend to announce the current stay-at-home order. By then, Ontario was about to top more than 4,000 cases a day.
Do you think the pace of the province's response to the third wave has cost lives?
At this point in time, there's absolutely nothing that would allow me to conclude otherwise.
Warnings, experts say, are still going unheeded to protect essential workers bearing the brunt of the pandemic. No action from Ontario to help them stay home when sick.
We need the government to do better. There is no doubt about that. There is still time to do better. It is not too late.
In a statement, the government defended its response to the crisis, asserting it's acted quickly throughout. Ellen Morrow, CBC News, Toronto.